It's a pleasure to have with us Dr. Abdullah Al-Hasso. Dr. Abdullah is a consultant clinical oncologist at the Beatson West of Scotland Cancer Centre in Glasgow since 2004, with special interest in breast and prostate cancer. He has special interest in clinical research, particularly radiotherapy. He has led the research work on breast radiotherapy at the Beatson, as well as the Breast Radiotherapy Service Development Program for over 18 years. He also has interest in prostate cancer radiotherapy, leading on several service development projects. He's involved in various charitable work, both locally and internationally, and he's delighted to be part of MAP team, the Medical Aid for Palestinians. Thank you, Dr. Abdullah.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. I'd like to start by thanking the organizing committee for their kind invitation for me to give this presentation about our breast cancer journey in Gaza. And my apology for not being able to join you live today due to my pre-existing commitments. I do hope and expect that you will be enjoying your fantastic program that you have, and that you will be able to make an excellent progress in providing a better healthcare service to our patients in Gaza and in Palestine. Medical Aid for Palestinians is a well-established organization that has long-standing presence in Palestine with an excellent connection across both the West Bank and Gaza. Oncology and cancer management represent a major health challenge around the world, and obviously Palestine is no different. But having these 2 points together, an established organization with a major health problem together, means that this is a great opportunity for us to deal with it, and we are in a good position to address these challenges. However, in Gaza, there is a special situation, obviously, and I would like to highlight some of these circumstances and challenges that we have. And clearly, not surprisingly, the blockade is a major factor that impact on life in general and certainly on the health sector. Now, there are economic challenges as well, and we all know that the cost of healthcare is rising. There are cultural challenges associated with cancer diagnosis. There are organizational logistic issues, human resources, and increasing workload. Looking at simple statistics like this, we can easily see that breast cancer is a leading cause of morbidity and mortality. 18% of cancer diagnoses are breast cancer, and if we look at in female population, 33% or breast cancer represent 33% of cases. That is a major health issue, and that is the scale of the problem that we need to address. And it's not just about the fact that this is the highest number and the largest population affected, but it's also about the fact that breast cancer is a potentially preventable problem, and therefore screening is important, and it's a relatively easy or easier to treat than other cancer, and with high success rate. Putting all that together make absolute sense that we should tackle this problem as the leading problem and use it as a model for other cancers later on. And that is one of the reasons, or perhaps the main reason, why it was felt that we need to focus on breast cancer and address this issue to start with. MAP and colleagues started their first mission to address breast cancer back in 2017. It was actually a fact-finding mission to identify the weaknesses in the system what are the areas of unmet need? What are the priorities? How can we move forward, basically? And it was quite clear that we need to work on a multidisciplinary team approach. And therefore, the focus the following year was to set up an MDT for breast cancer, and that's when it started. This is an excellent and the most important step, in my opinion, to try and improve on any service. And therefore, this MDT has helped to transform the services, improve the quality of care, putting various professionals together and addressing every single case that is diagnosed with breast cancer. The multidisciplinary approach is the standard of care worldwide, and therefore this is what should happen in Gaza, and I am delighted that this has been the case since that time. To build on that, it was quite important and very obvious that there is a need to enhance the multi-professional approach and the multidisciplinary approach within a context of an educational event. And therefore, the next step, the next natural step, in fact, was to set up the first oncology or cancer conference that is educational, but also is important to put all disciplines together, including medical, surgical, and nursing teams, as well as the allied health professionals, everybody under one roof, to sit together, talk to each other, and agree on ways forward and learn from each other's experience. I think this was a major milestone that was achieved in 2019 with an excellent feedback, and therefore there was a clear intention to have a second conference which took place last year as well. To build on that, and on the MDT principle, it was important also to then look at the quality of the service. How are we actually doing within these MDTs? Can we measure our performance and our achievement? So therefore, then the need for quality standards needs to be set up and identified and agreed upon. In other words, we call it the quality performance indicators. These were agreed on, and data were collected back in 2020. What that meant is that we now have a robust information system that can guide us into the future, can allow us to make an informed decision for our planning. And it also then provided us with the tools to provide clinical audits, research and studies that are specific and directly related to Gaza and its population and its patients. So it's not importing data from elsewhere and trying to implement it here. This is our own data. And I think this is quite important steps that are linked to each other and leads to each other. I feel I'm excited to hopefully be able to see some of the fruits of this huge work and effort that's been done by various colleagues behind the scene during our next mission, inshallah, scheduled in November. Along with all this, when we are addressing the healthcare system, it's felt that it's important that we actually also address the roots as well. That is to focus on the undergraduate junior colleagues, those who will be the doctors who will look after us in the future. We need to make sure that they are aware about oncology and principles of treatment of cancer and so on. So in collaboration with the Islamic University of Gaza, we have successfully launched the undergraduate summer module. The first one was in 2020. We could not have one in 2021, but we had the second one basically this summer. in August with excellent feedback, and we feel that this is an important step as well that needs to be continued and supported on an annual basis. Now, these are achievements that undoubtedly we should all those who have contributed to it should feel proud and happy about. But unfortunately, there are other challenges still on the way, and we do need to tackle these. And in my opinion, the first and the biggest challenge at the moment is the radiotherapy services and its development in Gaza is an absolute priority and the most important target, in my opinion. If we look at it from a population point of view, there is an absolute need by international standards for the population of Gaza to have this service available. But also, when we look at it from the logistic point and the practical point, having this radiotherapy service in Gaza is an absolute necessity, and that we need to all work hard and collectively to try and achieve this. And I think and I hope that you will all take this opportunity of your meeting now to address this issue and see how you can move forward, and or perhaps liaise with us as well, and we can work collaboratively on achieving this. Now, we have also in these, over the last 5-6 years, we've achieved really quite a lot as far as breast cancer is concerned. But that is not obviously the ultimate aim. The ultimate aim is to expand it further and to include other common tumor sites, and hopefully be able to achieve the same thing. In collaboration with the local medical and surgical teams, Ministry of Health, we need to develop guidelines and pathways for referral that will make it quite clear for patients on one hand and for the medical staff on the other hand how we deal with these problems, how we deal with cancer patients, what are the pathways for referrals, and how we can make it smooth and practical. These needs to be developed based on the local needs, the local resources, and the local system. Now, with the recent opening of the Palestinian-Turkish Friendship Hospital, which I was delighted to be able to visit last year, and with the excellent team, the management team there, I think this has made a big impact on cancer services, and I do hope and expect that this will have a future positive impact on cancer care in general, and hopefully with radiotherapy facility in it at some point in the near future. In my opinion, perhaps the other final, but certainly equally important area of unmet need is the drug availability and the lack of continuity of care that can happen due to that. I think this is an important area of unmet need, as I indicated, that we need to address and keep in mind. Now, these are all major challenges. We will not be able to achieve them all on our own. We need to work collaboratively as a team, together with the Ministry of Health, with the university, with the local medical team and other organizations in order to achieve all this. In my opinion, I believe it is doable, and I'm confident that with the help from the local team and other organizations, we will be able to achieve this in the near future. At the end, I would like to thank my colleague in MAP for their great support and efforts and work. That is highly admirable. I'd like to thank my colleague in Shifa, Nasser, and the Turkish Palestinian Friendship Hospital for their excellent work and progress that they have already made, and I include in that those who are working behind the scenes as well. And I would like to thank my colleague in the international team who are contributing to this success and the university colleague as well for their contribution and support. And I would like finally to thank you all for your attention, and I welcome any ideas or suggestions that you may have, and I'll be very happy to receive your comments through my email on the screen. Thank you very much again for your attention.